A dislocation is where the bones are partly or completely pulled out of their normal position. Someone with a dislocated joint will have severe pain, be unable to move the injured part, there may be swelling or bruising, and you can usually see deformity. Firstly, ask the patient to stay still and help them to support the joint to a comfortable position. Do not try and put the joint back in place. If you're dealing with an ankle, knee or hip joint, support the injured leg, usually using padding and broad fold bandages, and activate emergency services. While waiting for the EMS to arrive, monitor the patient and look out for any other problems. Hip problems can be very serious as there are large vital blood vessels which can become cut. If they have a dislocated shoulder or elbow, support the arm in a horizontal sling and add another triangular bandage rolled up to stop the arm from moving. Remove any watches or jewellery just in case there's swelling, which will make them hard to remove later. Call the EMS if you cannot take them yourself. If the patient goes into shock, treat accordingly, but don't raise an injured leg, just raise the other one. Finally, every 10 minutes, check for a circulation at the extremity to make sure there's blood flow. If circulation is not present, loosen the dressings.